when you open the door for somebody else.
So welcome, everyone, to the Vaccine Conversation Podcast with Melissa and Dr.
Yes.
Bob.
And it's a good thing we have a doctor in the house.
And
for
a
this
man,
episode.
thank goodness, because
I know, right?
God forbid
Right?
women have opinions here. I think we have a man to keep everything in check.
Well, we have medical
So.
stuff to talk about today. So we're going to use big words like asymptomatic.
Ooh,
And-
big words like government.
Yeah, well,
Big
that was,
words like they're lying to us.
I feel like it's been a while, but I guess it has. It's been a couple of weeks since you and I have
has.
podcasted.
It's been a while, but for them, it hasn't been that long, and we're going to keep this moving and trucking
Yeah.
along, just as if we've been in your living room every week at least, trying to give
Yeah.
you something.
Yep.
So the reason we're doing this episode, obviously, we've talked about this on some of our coronavirus episodes before, but there was a little controversy on this, and I remember you texting me one time saying, well, I found this South Korean study that talks about asymptomatic transmission and what percentage it is and whatever. And, me personally, I've been very concerned that the information that's been given on this idea of asymptomatic transmission has been very confusing. And I think people have misunderstood what it means. And I honestly am questioning the PCR tests and the false positives that are happening. I just shared a quote from a doctor yesterday who talks about basically these nasal swab tests are picking up elements of the RNA of the SARS-CoV-2 virus, not necessarily indicating it's an infected virus or a virus capable of infecting.
Right.
Which is a huge problem.
Right.
Because if all these people they're testing that they have no symptoms, like I've got nothing happening. I'm not pre-symptomatic. I'm asymptomatic, zero symptoms.
Right.
I never go on to establish symptoms, but I take a PCR test that somehow tells me I'm positive, and I either have to quarantine, leave my job, leave my household, whatever they're estimating here. In these different countries have different styles of handling with this. It could all be wrong. I mean, how often is somebody who has not been given a vaccine, how often is somebody completely asymptomatic for an illness? That's an actual question.
Yeah, I'd say that's...
Never go on to have symptoms. How often?
I'd say it's extremely rare.
For any illness.
I'd say it's extremely rare. Right.
Because you hear about people that are contagious before they have symptoms. But you guys, that's called pre-symptomatic.
Yeah.
That's a different thing. So are people getting tested and then 2 days later their symptoms start? And then, okay, that makes more sense to me. But we're talking about people that never had symptoms and never go on, but then get a positive test result.
Right. But I think the more important question is if somebody has COVID in their nasal passage and they are asymptomatic and they're not even pre-symptomatic, because let's say they're never going to develop symptoms, it's just like it's living in there, then I would say that they are not contagious. And that's kind of the whole question is, are these people who are pre-symptomatic, like they're going to have symptoms next week, but they have the virus in their nose now, are they contagious? Or is the second question is, people who just are carrying it in their nose and are never going to develop symptoms, are they contagious? And the short answer is probably not, and rarely. And, kind of in the grand scheme of things, no, we don't need to look at them as being contagious and as being, large or even small contributors to this outbreak. But I think the fear is that people do think they are contagious. They do think that people who are asymptomatic carriers or pre-symptomatic, they're going to have symptoms in 3 days from now, but 3 days earlier they have the virus. They're going to spread it around, and that's really what led to all this, social distancing and mask wearing and the big shutdown. Is there was this huge fear that asymptomatic or pre-symptomatic people were going to spread this. And one of the studies I have kind of talks about one of the very, very initial studies that sparked this huge panic. And then it turns out the study was wrong.
Right,
the study was
flawed.
an error, is flawed. There's this huge flaw in the study. And this is one study that led everyone to really worry and contributed to the shutdown policies. And if they had only done the study right, there might not have been as much initial panic. Maybe not. We might have still all done the same things, but that's kind of a big problem.
But isn't this the bigger concern? There's so much conflicting information. There's so many times the data wasn't right, or it wasn't there, or they didn't have the information, or they thought it was this, but now it's this. I mean, with the type of what they say draconian measures that they took as far as policy, you think you'd want to be absolutely certain and not be doing guesswork. But at the very, very beginning of lockdown, nobody was really worried about asymptomatic transmission at the very beginning. The very beginning, it was like, we've got this virus spreading through the community.
Right. You're symptomatic. That's how it's going to spread.
We're going to have all these cases. People are going to just, be dying everywhere. Then when the numbers didn't increase the way that they were predicted, and it wasn't spreading across the country the way it predicted, all of a sudden you started hearing, but there's this problem. Asymptomatic people are spreading this without even knowing. So you think you're healthy right now in your state right now. Turns out you could be a carrier and you're putting people at risk. And that's why we need to keep the lockdown. And that's why we need to keep kids out of school. This became the main argument was asymptomatic. In fact, that became the main argument for wearing masks. It was all about asymptomatic transmission. But I think my concern, when I first heard this concept of asymptomatic transmission, I automatically heard them saying pre-symptomatic is what in my mind.
Right.
You're asymptomatic now, but you're going to go on to have symptoms, or you're going to have mild symptoms. Like you're going to end up being somebody that has a cold, but you thought COVID was supposed to look totally different. So you never put two and two together that you had an infection, but it doesn't always look like something serious with everyone. But if those PCR nasal swab tests, if those tests are giving false positives, and these people who had no symptoms didn't actually have anything in their nasal passages, let alone being a small enough amount to like whether or not they infected, but they might not have had any at all.
Right.
It's shaping the policies for people to continue to lose their businesses, lose their incomes, because that's what the government has been acting upon. Mm-hmm. Now, if they do have it in their nose, but like you're saying, you don't believe it might not be enough that's also what these articles say, is that the viral load is less in the people that are asymptomatic and also in children. The viral load is less in children. It's less in asymptomatic people. The higher the viral load, the more likely you have the possibility of transmitting that to somebody else and infecting somebody else, which is the main concern.
Right.
It doesn't matter that the test is positive. If you can't get anybody else sick, who cares?
Right. So if you have a positive test and you are symptomatic, then of course you're contagious. Yeah, you stay at home. But yeah, there's a big problem with these false positive tests, or positive tests. Say it's not false positive, say it's a true positive, and you do have the virus in your nose, but you have zero symptoms. Yeah, you might spread it to someone if you're kissing them, if you're sleeping next to them, if you're breathing on them all night, if you have very close intimate contact with somebody, that kind of asymptomatic person might spread it. But as a doctor who's been around this, my whole life or my whole career, to me, someone who has COVID living in their nose, if they're sitting a couple feet away from you, talking to you, they're not coughing, they're not sneezing, they're not, putting their hands all over their mouth and nose and rubbing it all over you. Right. That virus is not going to move from, living, like dormant and quiet in their nose. It's not going to move and get inhaled enough into anyone around you if you're not spraying it. And so I truly believe that in the day-to-day casual contact, just being out and about and going to the store and being around, other people casually, that these asymptomatic, people who really have it in their nose, they're just not going to spread it. Maybe one person's going to spread it, in some city somewhere to one other person. There might be like a super, very rare occasional instance where it does spread in that situation. Right. But for me, you don't have symptoms, you're not contagious. And that's why I feel like, you were right about this whole kind of shutdown thing and these extreme social distancing measures. they were unnecessary. We could have found a better way to educate everyone that if you are feeling any symptoms at all, stay home. And that could have been enough to kind of get a handle on this. Concentrate on the symptomatic. And in fact, that's what people are saying now. That's what World Health Organization is saying. We need to concentrate on the symptomatic people.
Sure.
And then that's the key. I think that the main article that you found that we're going to be talking about, but there's going to be a few other articles. It's when is it from? June 8. So it's just a few days ago. Where is it published? Oh, Health and Science of what publication? Just NBC News.
This was everywhere. This was Medscape,
Okay,
CNBC.
yeah.
This was everywhere.
Yeah, so it's asymptomatic spread of coronavirus is very rare, in quotes, the World Health Organization says.
What was interesting too about this is when they published this, and this was put out, this article, saying that asymptomatic spread can occur but is very rare. Like I mentioned to you on our Facebook Live we just did, basically everybody started talking about it. It created a huge buzz because everybody's questioning the same thing. Well, why are we wearing masks then? Why are we still out of work? Why are we still out of school? And within a day, there was an update. And the update was interesting because even Medscape put out a second article to update it. And I'll give you the information on the update. Because they basically, in fact, the title of the update was "Who Walks Back Their Comments."
Yeah.
They're walking back what they said the day before, because this is the same thing we saw when the Imperial College model. All of a sudden, they realized, oh, we updated it, we changed it, we revised it. It sent the world a-blazing, and then next day, oh no, sort of it's still true if we wouldn't have this is total, what we call in PR, damage control.
Is that what they did with this?
This is what they're doing here, is because when Maria Vanderkoof, we've talked about her before actually, because she's really the representative from the World Health Organization that gives the commentary on COVID. When she gave these comments about this, again, everybody was like up in arms about, well, wait a second, what are we doing then?
Right. It means the whole shutdown was not necessary.
People are still shut down. This is not like the lockdown's over.
Right.
There are lots of places in our country that are still completely shut down or mostly shut down or partially shut down. So this is still affecting people like greatly. But they realized when that uproar started to happen that they had to back up and go, oh, wait, those comments were misunderstood. And that's exactly what they said. Yeah. But let's go into the actual the first article, and then we'll go into kind of the update. Remember, this title says asymptomatic spread of coronavirus is very rare. World Health Organization. This is somebody who's supposed to be respected all across the world. And the first thing in the key points of that first article says the preliminary evidence from the early outbreaks used to say that the virus would spread even if people didn't have symptoms, but now they're saying that spread is very rare, not just rare, but very rare. And that was what they said this was the part that was very worrisome, right, for the public health officials. They're saying leading to severe lockdowns and the policies about masks in public, because they said that patients with no symptoms didn't even know they were infected. Therefore, they were spreading. And they do go on to delineate between asymptomatic and pre-symptomatic in here, which was, that was an update. The original article did not. And they went back to clarify because that was something that has been so confusing to people.
Yeah, but they keep saying over and over again throughout the article, it's very rare. Mm-hmm. They say asymptomatic spread can happen, but we keep wanting to stress it's very, very rare. And they kind of talk a little bit about what I was saying earlier, that, Dr.
Vanderkoof.
Van Kerkhove?
Sure.
Oh, sorry.
Sounds good.
For sure. She says that some studies have indicated asymptomatic or pre-symptomatic spread in nursing homes and in household settings. So that's where more intimate contact is happening.
Right.
Nursing home workers and the patients, nursing home, people that are living there. And then in homes and family members, intimate contact, sure. Asymptomatic spread can occur, but they're acknowledging here, that's where they're early studies indicated that's where it was happening. I don't know that they even ever have published any good studies that show it's happening just out in the general public.
Well, what's interesting is they said that they're looking at these asymptomatic cases, they're following the contacts, and they're not finding secondary transmission.
Yes.
That
Yeah.
is a key point
Oh, yeah,
because,
yeah.
again, we're not talking about, so what, somebody's positive. A positive case does not mean anything necessarily. We're talking about the ability to pass that infection on to somebody, secondary transmission, and create a full-blown infection in somebody that will then again be able to be passed on.
Right.
You having a positive test result, being asymptomatic, is not indicative of spreading COVID. And then they said, if asymptomatic spread, however, proves not to be a big driver of coronavirus transmission, the policy implications could be tremendous.
I know.
And this was the first,
Right.
this is the very first version of the article
Okay.
that was posted June 8th. It says asymptomatic is very rare. They're not showing secondary transmission. And if this is true that asymptomatic transmission is
Right.
not the big driver of the COVID spread in the community, then the policy implications could be huge.
I know, because they refer to how the Centers for Disease Control in the United States used the potential for pre-symptomatic transmission as a reason for the importance of social distancing.
Right.
And if that's no longer a valid reason, and it never was, then you're right. The implications for the policies we've made
Right.
are huge. And they keep saying we need to do more research. They talk about how other countries have been doing this research and are already doing it. They're continuing to do it. And they're following cases. They're doing, using contact tracing to follow asymptomatic people. They're following all their contacts. And like you said, they are not finding secondary transmission onward
Right.
from those asymptomatic patients. She's saying the preliminary findings are that they are not finding this kind of
Right.
transmission. And so they say, for the fifth time in this article, it's very rare. If it's happening, it's very rare. And I have a feeling it's going to be happening in the more intimate settings, not just the general out and about in public settings.
And what she said in her quote, the available evidence from contact tracing reported by member states suggests that asymptomatically infected individuals are much less likely to transmit the virus than those who develop symptoms. So again, this is the difference between pre-symptomatic and asymptomatic. Those that are pre-symptomatic are going to have a higher viral load because they go on to develop symptoms. And then in another tweet, she says, in these data, it is important to break down truly asymptomatic versus pre-symptomatic versus mildly symptomatic. Also to note that the percentage reported and estimated to be asymptomatic is not the same as the percentage that are asymptomatic that transmit. So even the number of
Right,
asymptomatic does not necessarily mean these are the groups of people that go on to pass this on to somebody else. This is one of the other things in this article that I find very hard to believe. I've seen this. I posted about prisons. I posted about the numbers. Mm-hmm. This doesn't make any sense to me. So in this article on CNBC, it says, in closed cohorts, there appeared to be a high rate of COVID cases without initial symptoms, okay? Over 3,000 inmates in Arkansas, North Carolina, Ohio, and Virginia, okay? 96% had no symptoms at the time of testing. 96%. There is just no way There's absolutely no way unless the test is flawed. And they're
Right.
using all the same tests on these people. It's all the
Right.
same standardized type of test, whatever it is.
Yeah, and keep in mind, I think everyone's forgotten, there is not, correct me if I'm wrong, I know you will, I don't think there is yet to be a validated test
You're
for
right.
coronavirus by the FDA.
Right, you're right.
I mean, I looked at their website a week ago to try to figure out what test can I order if I need a test or my patients need a test. I can't find a single
Right.
approved, validated test by the FDA anywhere, whether it's a nasal swab, an oral swab, whether it's the PCR or the antigen testing. Nothing.
Right.
Nothing has been officially FDA approved. It's been approved for emergency use, all right, approved, like,
right.
let's use it so we can start, testing everybody. But I mean, that's the FDA's job, is to take every single test that's out there for any disease and put it through the ringer to make sure it is valid. Make sure there's not, a lot of false negatives, false positives, make sure it's accurate. We don't have such a test yet. And I think a lot of people forget that. I think people are totally forgetting the potential for inaccuracy with these tests.
And there are so many different manufacturers of all these different
Right.
tests. So it's like, how would we even know? And so what one of these doctors they quoted in this article says, that I alluded to already, he said, another limitation to capturing the accurate data is the method of testing. The real-time PCR testing using the nasal swabs can detect the RNA fragments from the virus, which could potentially affect the results. His quote is, "It's really hard to know what is actually infected virus versus just fragments of RNA that make the test positive." That's a problem.
Right.
That is a huge problem, because every day there's a COVID ticker. There's the COVID count.
Right.
And it's, Orange County has this many more cases. And this, it's like,
Right. Well, and the reason why that matters is if you have, say you have like, a million live COVID virus particles in your nose, and you're infectious, and maybe you're going to start having symptoms. So you're probably going to be contagious. If you're not already, you're going to be soon, because you have, millions of live COVID virus particles. If you had it like weeks ago, or if you have maybe like a mild case or just a tiny little bit of COVID, virus in your nose, but it was your immune system fought it off and killed it off. And so now you just have some of the RNA fragments. RNA, just in case people don't know, is essentially just like DNA. It's for viruses. Like some viruses have DNA as their genes. Some viruses have RNA as their genes. They're very, very similar. So it's basically the genetic codes from the virus that, is residual, and it hangs out, and it's the virus leaves it there after the virus dies. So all the COVID in your nose could be totally dead.
Right.
Could be totally dead. Your immune system killed it off and it's gone, but there's RNA hanging out. The test is going to find that and could then register positive. So that's what they're talking about.
as if you're currently positive.
Right.
Yeah.
And where in a lot of cases you're not. So that's very interesting.
Well, so they did the update. So I'll talk about the update, and then you can go
Yeah.
into the actual studies.
Yeah.
The update. So the next day, they didn't wait long. The World Health Organization officials on Tuesday walked back the comments that were made on Monday after drawing criticism from epidemiologists across the world. Okay. Dr. Maria Van Kerkhoff, head of the WHO's Emerging Diseases unit, said that on Tuesday that asymptomatic spread is now she's saying, is a really complex question, and much is still unknown. She says in quotes, "We don't actually have that answer yet."
Yeah.
Okay, so not only are you trying to cover your ass because basically you said something that's now making people a little bit upset, frankly, that they've been locked down for no reason, you're now admitting you don't know anything. Because you know what I'm saying? Like, you're the top infectious disease specialist at the World Health Organization. You literally have access to every single piece of information more than anybody else could have. And you're still telling me you don't know anything? I mean, how embarrassing is it at this point?
Yeah, and how can they not know? I feel
That's
like
my point. Of course they know.
I know. They have to.
Of course they know.
But you're right. If they've had the data, first of all, if they've had the data to show that, yes, asymptomatic transmission that's going to cause secondary infectious cases is a problem, it's happening, and we know it's happening, they would show us those studies. They would show us that information. They'd be publishing that. And so I would have to believe that they probably don't have that kind of data, that it's happening. I can't believe that they don't yet have good data to show that it's not happening. Right? They've had 6 months now to study
that's
this.
my point.
So,
if in fact they don't know, then that's embarrassing. Then get somebody in there smarter.
So there's got to be data. So
of
why?
course there is.
And if the data are showing that, as they're saying here in this article, asymptomatic transmission is very rare and it's not contributing to the widespread use of coronavirus, to have to basically say, we got this wrong. We didn't have to do all this. I mean, that would be, hugely embarrassing. But I mean,
But it's the
kind
right
of
thing
their
to do.
responsibility.
No kidding.
They're the World Health Organization. So they didn't have the data 4 months ago. As soon as they got the data, now let's make a change. And we're seeing this all over the place. Politicians and policymakers and people in authority are afraid
Of course.
to change direction.
The models.
They're afraid to accept new data that's going to say, okay, we need to turn right a few degrees and go in a little bit different direction because now we have new data. I mean, what's wrong with that? I mean, scientists do that all the time. We study, we learn new things, and then we make different decisions. And it's frustrates me that they're not willing to do that.
Because they have blood on their hands, essentially, with all the people that had to suffer and people who actually died. People have died as a result of lockdown policy. So you can't walk it back at this point. Remember all the models that were so flawed? They didn't go, oh, the model was flawed and so it's our fault, our bad, but now we're going to go in this, like you said, go in this direction. No, they didn't do that. They didn't do that because what they just covered it up and kind of detracted and went in a different direction and went, oh, but this new model says this, and they get back to the fear, get back to fear. Because if people are afraid, they don't care about the details. They're not listening for the details. They're not listening for the substantiated evidence.
Right.
So she continued with her quote. She said, I was responding to a question at a press conference. I wasn't stating a policy of the World Health Organization or anything like that. I was just trying to articulate what we know. But what did she articulate? That it's very rare. And she just said that that's something they know.
Yes. Yeah.
Hello. And then she said, and in that, I use the phrase very rare. And I think that's misunderstanding to state that asymptomatic transmission is very rare. I was just talking about a small subset of studies. And, this is, again, damage control 101. Oh, no, I didn't mean this. This is what I meant. And obviously, like you're saying, the implications were so big that they realized what they had accidentally said by saying it. And they had to publish, again, a second article in Medscape as well. And there was, they said the remarks drew skepticism from physicians and others across social media. And they backtracked this and they said that studies show about 16% of the population may be asymptomatic. That's what she said. Some other models have suggested as much as 40% is asymptomatic. Okay, so that's a huge difference already. They really have no freaking clue, or they're not giving the real information. They're giving this very, very conflicting information out. And she said the 40% statistic is from models. These are from models. They're assuming 40% are asymptomatic. So she said she didn't include that in her answer, but it's just based on a model. Can we stop using models for something that's affecting people's lives at this point? I'm sorry, but this guesstimation that they've used is not good enough. It's not good enough. And again, they're not even backing up where they're getting this information from. And now they want to say that information was misinterpreted. No, the information wasn't favorable. It wasn't favorable. And so now they want to play damage control. No, it's because the information did not make them look good. But clearly it's what they knew. She wouldn't have said it. She would not have said it.
Right.
She doesn't make a mistake like that. This girl's the head of the infectious disease element there at World Health Organization. She's not going to make that kind of mistake.
Right.
What happened was she slipped. Yeah. She slipped as if she's talking to her colleagues because they're allowed to talk about it there. She realized, and now this is videotaped and all of a sudden it goes around the world and now she has to back it up. This is the kind of stuff that should be infuriating people.
Yeah.
Because it's affecting people's lives.
Yeah.
Anyway, into the study.
Yeah. So, one original study, so this is one of the first studies that kind of contributed to the panic, and it was published in New England Journal of Medicine. So that could be one of the world's most premier journals, if not the most premier journal. So it's called Transmission of 2019 nCoV infection from an asymptomatic contact in Germany. And what this was it was a letter written by a whole bunch of doctors.
I remember
probably
this.
like 20 doctors or something in Germany. And so it's not even so much, it's sort of like a kind of a study, but it's mostly a letter, right? And it's in their correspondence section. So it wasn't like a peer-reviewed research study. Basically, it said, we are reporting a case of COVID-19 infection acquired outside Asia in which transmission appears to have occurred during the incubation period in the index patient, meaning when she was asymptomatic. She was essentially pre-symptomatic. Okay, so this was like a few days before they thought she eventually became symptomatic. And what this person did is she traveled from Asia to Germany and met with some business colleagues for some business meetings. And once she left,
I remember this.
two of the colleagues came down with confirmed COVID, and then they spread it to a couple of other people. All four of them are fine. They were all very mild cases. But then the woman, they ended up hearing that the person from Asia also got sick. Right.
She has symptoms.
So basically they kind of panicked and said, and the doctors, this whole big, huge team of doctors, it's not just one doctor, it's a whole team. They interviewed the 4 German businessmen and interviewed them about everything that happened. And the 4 German businessmen said, yeah, our Chinese colleague was not symptomatic. The person looked fine. They were not coughing. They didn't look sick. The person looked fine. But somehow they gave 2 of us and then eventually the 4 of us COVID. Mm-hmm. So these doctors said the fact that asymptomatic persons are potential sources of COVID-19 infection may warrant a reassessment of transmission dynamics of the current outbreak. And this, everyone panicked, and so they published this, and everyone kind of took it to mean, oh no, these asymptomatic travelers from China are now going to spread COVID all over the business world of Germany and Europe, and we need to shut it all down. And because they believed that the person was asymptomatic, they never called the index patient. They didn't talk to the index patient. They just took the word of the 4 German businessmen that this person was asymptomatic.
Right.
So that happened, and then about a week later, someone from the German public health department finally got a hold of that index patient in China and interviewed the person over the phone. And that person told the public health officer, oh no, I was symptomatic.
Right. When she was in Germany.
Right. I was symptomatic when I was in Germany.
Right.
And so there's a second, so they published this. They basically published study claiming new coronavirus can be transmitted by people without symptoms was flawed.
Right.
All right. So this was published. This was maybe a week later after the very first the first letter was sent in to New England Journal of Medicine. And so I just want to read a few things from this thing. It said, the original study seemed to confirm what public health experts feared, that someone who has no symptoms can transmit it to others. And it's almost like they needed fuel for the fire. Mm-hmm. They needed fuel for the pandemic to make everyone worried. Chinese researchers had previously suggested asymptomatic people might transmit the virus, but the Chinese researchers had not presented clear-cut evidence. So now, with this one case of one person supposedly transmitting it to 2 and then 4 Germans, Anthony Fauci chimed in and said, quote, there's no doubt after reading the New England Journal of Medicine paper that asymptomatic transmission is occurring. The study lays the question to rest. First of all, this was not a study. It was a letter written about one person who was sick, all right? So what they found, maybe a week later, the researchers didn't actually speak to the woman who was the index patient from China. They did not speak to her before they published the paper. They relied only on information from the 4 Germans. The 4 Germans told us the patient from China did not appear to have any symptoms, but then afterwards they talked to the woman. It turned out she did have symptoms. She felt tired, she had muscle pain, and she took a fever-lowering medication.
Right.
And then she also confirmed later, again, that she had symptoms
Again, while she was there in Germany,
while she was
not
there
just in
meeting
China.
with these business people. So there was a virologist who was one of the study's authors. He said, "I feel bad about how this went, but I don't think anyone is at fault here."
Of course not.
Apparently, the woman could not be reached at first, and people felt that this critical data had to be communicated quickly. So it's a shame that all these researchers felt like they had to rush to get this published without, verifying all the information and without verifying the single most critical part of this study, whether or not the index case had symptoms. They just totally skipped that. And Mark Lipsitch is an epidemiologist at Harvard. He says, calling a case asymptomatic without talking to the person is problematic. It sounds like, it was a poor choice to overlook that. And, he kind of, talks a little bit about when we're in a crisis, when there's a global pandemic crisis, given how fast the data are coming out, it's good to read even peer-reviewed papers with some extra caution during this kind of time. Lipsitch says, I think peer review is lighter in the middle of an epidemic than it is at normal speed. The quality of data that is going into papers like these is more uncertain. So it's kind of a good point. We're all in such a rush to get to the bottom of this. But we do need to be careful because when you publish something like this that has such huge implications that you really have to get it right. And couldn't they have waited, a day or two to put this out there? And they kind of continue on just sort of ending that, Dr. Fauci, who we've, talked about before on this, still believes that asymptomatic transition can occur, but they talk about how the World Health Organization feels that it likely plays a minor role in the epidemic overall. And that's very important to understand. So there's this final study that was just recently published. When was it? Let's see. May 12th? Yeah, May 13th, where they actually did study an asymptomatic person. So this is very interesting. The study is called A Study on Infectivity of Asymptomatic SARS-CoV-2 Carriers. And this was in respiratory medicine. And again, we'll put a link to this. But what these researchers did out of China is there was a woman who had a severe cardiac condition. So she was admitted to a hospital just to take care of her cardiac condition. She did not have COVID, at the time or anything like that. She was just admitted to the hospital and she spent some weeks in the hospital. And she was exposed to many, many patients and family members and many doctors and other healthcare workers in the hospital, all without having any COVID symptoms. So then she developed COVID symptoms and they tested her and she was positive. So then they quarantined her and she ended up, doing okay, even though she had cardiac problems. But what these researchers did is they took advantage of the fact that she would have been, pre-symptomatic or asymptomatic during the days or weeks leading up to before her symptoms started. And so here they have an opportunity to contact, trace, and research everyone she was exposed to while in the hospital and while going around the hospital and interacting with other patients and other people, while she caught the virus but did not yet have symptoms. And so what a great opportunity. So what they determined is out of the people that she came into contact with, and then out of everyone that those people came into contact with, there were 455 people that they got to study. So they divided these people into three groups. There were 35 patients that she contacted or her contacts came into contact with. There were 196 family members that all of these patients were around. And there were 224 hospital staff that all of these patients came into contact with as well. So, a lot of people to study. And they said the median contact time for patients with this index case was 4 days, and for family members was 5 days, and including then all the people she came into contact with and the contact they had with everyone else. Median contact was 4 days and 5 days. And interestingly, 25% of her fellow patients that she came into contact with on the cardiac ward had severe cardiac problems. So they're all at severe risk of having a terrible case, right? So the good news is once she was symptomatic and she tested positive for COVID and they quarantined her and all her contacts were quarantined, everyone was then quarantined except for a lot of the hospital staff. 7 of those contacts came down with symptoms, and 1 family member. All right, 7 patients in the hospital with her, and 1 family member developed respiratory symptoms. They were all monitored and tested for COVID. Not a single one tested positive for COVID. Not a single one. So they conclude that the infectivity of some asymptomatic SARS patients who are carriers might be weak. That the infectivity during the carrying period, while they're asymptomatic, the infectivity might be weak. And that's a very important point. And not only is it weak, there was 0 spread of the virus from her to her contacts, from those contacts to other people. So that's actually very good news. Was very excited to read this. And yeah, it was only 1 index patient, but a lot of contacts. And so I think the take-home message here is, from the World Health Organization and from the research we do have and from the available data, that asymptomatic people, contribute very minimally to this pandemic. Pre-symptomatic people who are eventually going to have COVID, but don't have symptoms yet, they contribute very little. Their infectivity is very, very low. And we now have good data to support that. And we've, verified that the initial worries about asymptomatic or pre-symptomatic people that were published earlier in this outbreak were problematic, and those studies were done wrong, or some of those studies were done wrong. So I think we can all rest assured that, when we're out and about in public, people around us who have no symptoms, we don't have to fear them. Yeah, maybe we keep social distancing if you want and wear a mask or don't wear a mask, but I think there's less responsibility to wear masks given this information, and there's less responsibility to social distance. And it could be that these strict policies that have really, harmed our economy, our global economy, possibly were unnecessary. And we're learning this more and more. So let's wrap this up now. I think we've kind of gotten to the end of this, and I'm excited about the next topic, hydroxychloroquine, and we'll get to see, kind of new information we've learned about that. So thank you for joining us on the vaccine conversation, and we will see you next time.
The information in this podcast is for entertainment purposes only. It is not intended as medical advice. Always consult your healthcare professional for information on vaccines and infectious diseases.